Welcome to the Alliance List, the podcast that brings you closer to the people driving change in health policy and systems research around the globe. I'm your host today, Idil Shekh Mohamed. In each episode, we explore the experiences of Alliance alumni making stops along three places: learning from the past, living in the present, and leveling up for the future. Whether they're shaping policies in ministries, advancing research in universities, or, as in today's episode, strengthening individual and institutional capacities for health systems in Francophone Africa, our alumni are raising critical questions, sparking action, and expanding the frontiers of HPSR. I'm so pleased to welcome today's guest, Dr. Rachidatou Compaoré. Rachidatou is a public health physician in Burkina Faso and a researcher with over a decade of experience working at the intersection of health policy, systems research, and reproductive health. As a researcher officer at the Institute of Research in Health Sciences in Ouagadougou, her work has informed a national malaria control strategy and changed practice around maternal care across West Africa. She's a familiar face at WHO, in particular among the health research programs. She's participated in the Health Policy Analysis Fellowship supported by the Alliance, and she has helped us to implement the CRESPR program to strengthen HPSR capacity in Francophone Africa. Beyond that, she's also helped coordinate the HRP Alliance Hub in West Africa for the Human Reproduction Program. She has a doctorate in medicine, a master's in public health, and is currently completing her PhD in public health, focusing on the quality of safe abortion care in sub-Saharan Africa. Rachidatou, welcome. It's wonderful to have you with us today. We had to reschedule this once because you were attending a national OBGYN Congress, and I imagine it must have been a full and interesting few days. I'm just curious to hear a little bit about how it went.
Thank you, Eden. Yes, this conference was very, very interesting. We were exploring challenges in maintaining good health for mothers and newborns in Burkina Faso, especially in humanitarian settings. And sharing experience in this context was very, very insightful. I shared my study on how health workers were willing to give safe abortion care. That this is a very sensitive question, and sharing it with practitioners were very, very interesting, and there was a lot to do more after.
That sounds really fascinating, and I'm so happy you were able to attend. But even more so that we have you now with us today. So let's rewind a little bit. This is our segment called Learning from the Past. You originally trained as a medical doctor in Morocco. What inspired your move into public health and eventually into health policy and systems research?
My journey into public health and into health policy and system research has been deeply rooted on my continent, Africa, and shaped also by good opportunities and powerful collaborations. My path into health policy and system research didn't begin in lectures. It didn't begin in conference rooms or policy papers, but it began in everyday encounters with people navigating complex health systems across diverse settings in Africa. When I said that I want to take a medical training, my father, that passed away some few years ago, said that he didn't believe that I can be a medical doctor. And what he said is that when someone who can watch TV and weep with people that are suffering won't be able to sustain real pain in everyday practice. So I wanted to prove him wrong, and I went through my studies, but then I shift to research. Why? Because through my medical degree in Marrakesh, I first wanted to be a pediatrician. But when I was in the pediatrician wards and seeing these little babies, small kids suffering, and most of the time, what we should do is not only give them care, but there were other factors such as poverty and also a social background and this kind of thing that we didn't have real power to do something there. So when I took my public health studies and during my training, I thought that I can have more power. I can contribute more through this discipline than being a clinical. So I shift from clinical to public health training and then to research.
Thank you so much for sharing that, Rachidatou. It's really inspiring and beautiful to hear how you made that journey. And it sounds like sort of during your training, you saw what we call the social determinants of health, that it's not only just about the care, but the other factors that are affecting health. You spoke a little bit about mothers, about babies. As we heard in the introduction and your experience now, you worked extensively in maternal, sexual, and reproductive health. So how would you say your focus on adolescent sexual rights and safe abortion care has evolved over the past few years?
My real experience with sexual and reproductive health and mostly with abortion started with WHO-HRP Alliance, a multi-country study on safe abortion. And the first stage was in 11 countries in Africa. And we were leading the study for Burkina Faso and also then coordinated the study for the West African Francophone countries that were participating in this study. And that was my first encounter with research in safe abortion. At first, it was challenging because that was when I realized my positioning with my culture and also my education. I realized the weight of unsafe abortion on maternal mortality. And then when I had to choose a topic for my doctoral research, I went through this research. And sometimes people will ask you, but why are you interested in abortion? You must shift your topic from something more important. And I say that this also is important because it's the third or the fourth maternity cause in most of our African countries. So that's how I started with abortion. And then through my research, as evidence was coming out, I've seen that there is some inequity between adolescents and older women. They face more difficulties in accessing care and also face more stigmatization. And that's another of my main research topics now, adolescent health. And right now, we will start a study on how to autonomize adolescents in sexual and reproductive health in humanitarian settings, especially here in Burkina Faso. Burkina Faso is facing a security crisis since 2014, and it has a real toll in public health and sexual and reproductive health access in many of our regions. So we want to tackle this. So that's how I came to this topic.
Yeah, and that leads me sort of to my next question. You've mentioned some challenges already, but what are some of the challenges you encounter doing policy relevant research in Burkina Faso or other similar contexts in West Africa?
It starts with resources. Because when you want to conduct a study, especially in our settings, you face the lack of resources. The most important one is financial resources to conduct this study, because most of the time we are invited to participate in some studies, and then you don't have really power to choose the topic, the theme of this research. They come with a protocol and you just have to help implement this protocol. So developing your own theme based on your settings, priorities is not really an easy task in our settings. But also when you conduct research on sensitive topics, you also need some support to stay strong and continue with these topics. What we also face is access to materials, like to access good papers that sometimes you have to pay online to access, and After, when you want to publish and these kind of things, you have the challenge of the study first in your own language, then translated it in French, and after you have to translate it in English too. So these are some kind of challenge we can face in our context.
Yeah, thank you so much for sharing those challenges. And it sounds like you are operating in a not so conducive environment, but despite that, it seems you're doing brilliantly. So thank you so much for your work.
Thank you.
Now I thought we could talk a little bit about your engagement with the Alliance before discussing what you're working on currently. You are part of the Alliance's Health Policy Analysis Fellowship Program, which supported PhD students to integrate policy analysis into their research. Could you tell us a little bit about what that experience was like for you?
It was incredible. It was like a meeting. A need. I had some needs and I didn't know where to turn to have some answers to these needs. I can say that this experience changed the way I see how doctoral studies could be, and also changed the way I see systems. When I started my doctoral protocol, I can say that I only had a view on health services settings, how they work and how it impacts safe abortion care. But through my HPL fellow experience, I had to expand it to a health system perspective. I learned a lot about politics, power, and how they really shape health access and health impacts. And I began to engage deeply with concepts like reflexivity, looking inward on how my own position shapes what I notice. And I also became more aware of my positionality and how being a Francophone African woman shapes my legitimacy, access, and sometimes my limitations in global spaces. And also, we weren't taught or just methods. We were invited to think critically on power, politics, and inequity, and not just as topics of research, but also as live realities embedded in our field. So this fellowship helped me learn also about discomfort, value collaborations, and embrace intersectionality as essential to understanding health systems. Yes, I am really thankful for this opportunity. Yeah.
That's wonderful to hear. We're so happy to hear that. And you've also contributed to implementing the Alliance's CRISPR program, which strengthened institutional HPSR capacities. And I think maybe you even came up with the acronym, if I'm not wrong. And since your French is better than mine, maybe you can tell us what the acronym CRISPR stands for. In addition to that, also tell us some key lessons or moments that stood out for you while you worked with that program.
CRISPR means Capacité de recherche en système et politique de santé en Afrique francophone. So this was a wonderful, I can say, adventure. And where did it start? It started with my HPA fellowship. When I started, the first thing that I noted was that I was the only French-speaking participant. I had a wonderful experience, as I said, both in human relationships and also academic learning. So these skills, core skills that I learned and this concept, I wanted to also share my experience with my fellows in my context. And the CRISPR project came like an answer to this ambition. So that's how I came from this HPL fellow to also a CRISPR mentor. It was like learning twice and also having the opportunity to giving back.
It just makes me smile, you retelling this, because it sounds like being part of the HPO Fellows Network, being a mentor and an implementer for the CRISPR program, and engaging in other similar HPSR community networks has meant growth and being able to collaborate obviously not only on a professional and on a career level, but also on that interpersonal level that you were talking about. We're going to move now to the next section. Let's fast forward to today. This is living in the present. We talked a little bit about some of the challenges that Burkina Faso faces and how the country is navigating significant health system challenges. Could you share with us briefly how you see the research that you're conducting contributing to broader health system strengthening?
I can say that we do our best to bring evidence and good evidence, strong evidence that can shape policies. But as you know, translating knowledge to evidence to policy is not always as easy as it should do. So I think that we are doing our best on that way. And also we are contributing in building capacities, not only in Burkina Faso, but also in the sub-region. We are sharing knowledge and also building capacities within our different institutions and trying to shape the next leaders for this field in our sub-region. What we are trying to do now is to do good research, not just for publications or career advancement or early recognition, but what we aim for is doing research that will give some evidence that will contribute to promoting well-being in terms of health and rights.
That leads me straight into my next question. You're conducting research and you have the evidence, let's say.
Yeah.
What have you learned about communicating research and collaborating across different contexts and institutions?
What we have learned is that research is not limited to researchers. We are trying to shift this understanding. We are not only those who hold knowledge, but also the population where we are conducting research are also knowledge holders that we can learn from. So what we are trying to do is going beyond only our team of researchers, beyond multidisciplinarity to more transdisciplinarity, and also trying to go beyond giving feedback from like we have discovered something great, but we have to learn how to translate it in a way that is understandable to policymakers, but also to communities to have better impact. We are still on this task, so we are learning by doing. I can say that.
Yeah. Learning by doing. That's fantastic. Let's shift to the future now. This is leveling up. You and I first met in March during a workshop hosted by the Alliance focused on new frontiers for HPSR. In the meeting, we discussed many things, including what areas deserve more attention and need to be highlighted when conducting HPSR. In your view, what are some areas of health systems or policy research that you believe deserve more attention in West African contexts, like Burkina Faso?
I think that we should start by shifting the way we frame it and maybe give more leadership to local researchers, local policymakers to express their real needs in terms of what is important for them, to their communities, to their populations in terms of public health problems and public health priorities. And also really have a real collaboration, not just directing what you should do, but giving a real leadership to local leaders. And we can share knowledge, we can build capacities, but we can really explore this decolonization theme and how we should do it.
Yeah, you've started to already answer my next question, which was going to be what kind of structural support or change would be most helpful for researchers like you to thrive?
It's a critical question, but I think that we should try to multiply initiatives like the CRESPR one to break this language barrier. I know that it's not only French-speaking countries in Africa that face these barriers, but I think that this language barrier to expose people to more knowledge, to let them have more opportunities with grant submissions and also have the capacity to get their own grants to conduct the studies and the research that is more important to them will foster more collaborations, and it can be a start. It can be a start.
Amazing. Rachidatou, thank you so much. It's been a pleasure to hear your story, your insights, and your reflections. Before we close, is there any else you'd like to share, a final thought, a message for our listeners and viewers?
Thank you really for this opportunity to share my little experience. As I said, what we do, we should do it for people, for their better health, for their better well-being, for them to enjoy their rights in all the terms. Because at the end of the day, evidence should serve dignity, and the health system should reflect justice, and research should always be rooted in care. That's the kind of work I believe in, and the kind of future I hope we all continue building together from the heart, by doing what we love. Yeah.
That's a fantastic final reminder. Thank you so much for that. And a
Thank
big
you.
thanks to our listeners and viewers for joining us on the Alliance List. If you've enjoyed this episode, please share it with your network, especially those working in health systems and policy. You can also join the Alliance Alumni Network on LinkedIn to stay connected and hear more stories like this one. Until next time, take care and keep doing the work that lifts others too.